Bupropion is an antidepressant drug that inhibits the reuptake of norepinephrine and possibly dopamine. Most significantly, it does not act on the serotonin system like SSRI antidepressants. This results in a side effect profile characterized by a low risk of sexual dysfunction and sedation and with modest weight loss during acute and long-term treatment. No withdrawal symptom has been linked to discontinuation of bupropion. Although increasingly used as first-line monotherapy, a significant percentage of bupropion use occurs as add-on therapy to other antidepressants, usually SSRIs. Bupropion has been marketed for use in smoking cessation regimens. Pharmacologic actions of bupropion. The formulations of bupropion are available: immediate release taken 3 times daily, sustained release taken twice daily, and extended release taken once daily. The different versions of the drug contain the same active ingredient but differ in their pharmacokinetics and dosing. There have been reports of inconsistencies in bioequivalence between various branded and generic versions of bupropion. Any changes with this drug in tolerability or clinical efficacy in a patient who had been doing well should prompt an inquiry about whether these changes correspond to a switch to a new formulation. Immediate release bupropion is well absorbed from the GI tract. Peak plasma concentrations of bupropion are usually released within 2 hours of oral administration, and peak levels of the sustained release versions are seen after 3 hours. The mean half-life of the compound is 12 hours, ranging from 8 to 40 hours. Peak levels of extended release bupropion occurs 5 hours after ingestion. This provides a longer time to maximum plasma concentration, but comparable peak and trough plasma concentrations. The 24-hour exposure occurring after administration of the extended release version of 300 mg once daily is equivalent to that provided by sustained release of 150 mg twice daily. Clinically, this permits the drug to be taken once a day in the morning. Plasma levels are also reduced in the evening, making it less likely for some patients to experience treatment-related insomnia. The mechanism of action for the antidepressant effects of bupropion is presumed to involve the inhibition of monoamine and norepinephrine reuptake. Bupropion binds to the dopamine transport in the brain. The effects of bupropion on smoking cessation may be related to its effects on dopamine reward pathways or to inhibition of nicotine acetylcholine receptors. Next, we will talk about therapeutic indications. It is used for depression, and then it is also used for smoking cessation. It is also used for bipolar disorder. It is also used for attention deficit hyperactivity disorder or ADHD. It is also used for cocaine detoxification. It is also used for hypoactive sexual desire. It is also used, there are some precautions and adverse reactions of this drug, and there are some also drug reactions, and then there are some laboratory interference and doses and clinical guidelines. We will read this later on. This is simply about the idea of bupropion and pharmacologic actions. And we will talk about the therapeutic indications of bupropion later on in the next video. Thank you.